in the early, evaluating early childhood development programs, and it's called Doing Community-Based Evaluation. This event is hosted by the Center for Community-Based Research in partnership with the Evaluation Capacity Network. And thanks for joining us today. We go to the next one, Sherry. We've got a few facilitators here today. I'm Judith Walton. I'm a Master's of Social Work student and an intern at the Center for Community-Based Research. We also have with us Sherry Rezvani, who is a researcher at the Center for Community-Based Research, and she's also our technical expert on the webinar. So if you have any issues or concerns, just put those in the chat box and she'll take good care of you. And we also with us here today have Rich Jansen. Rich is the co-director of the Center for Community-Based Research and has been involved in over 130 community-based research and knowledge mobilization projects. His work has included multi-partner research initiatives, community mobilization, program change evaluation, and needs assessment with direct policy impact. These projects have focused on a range of issues, including immigrants and refugees, community mental health, disabilities, family support, and faith and justice. And we're also fortunate to have April McDonald-Killens here with us today. April is the manager of community resilience at ABC Head Start Society in Edmonton, where she oversees the development, monitoring, and evaluation of programs that support families from more than 72 countries. She holds a master's degree in global leadership, and her graduate research focused on equitable access to post-secondary education in the arts. With ABC Head Start, April has had the privilege of partnering with faculties from the University of Alberta on 2 major community-based research projects and is currently overseeing the execution of a community-based evaluation. So welcome everybody. Before we begin, we'd like to take a moment to acknowledge that the CCBR office in Waterloo is located on the traditional territory of the Neutral, Anishinaabe, and Haudenosaunee peoples and is situated on the Halaman Tract, the land promised to the Six Nations. The webinar is expected to be about an hour long. We should end around 1 o'clock. And I mentioned before that Sherry is our technical expert, so you can just let her know if you have any issues. We also want to hear from you as well, so we'll have some time at the end to have a bit of a discussion. And so please use the chat box to type in your questions or raise your hand, and we can get you and answer your questions. And this webinar will be recorded and will be available on the CCBR and the ECN websites. This is the second webinar in a series of 2 webinars. So if you missed the first one, it is posted on both the CCBR website and the ECN website, so you can take a look there. And these webinars are a part of more tools that are available to you. So they go hand in hand with some self-study evaluation tools that are being created to promote community-based evaluation in the early childhood development field. There's a couple of tools available. One is a self-study set of 5 slide decks, which have a corresponding evaluation workbook. And those will be coming soon to the ECN website. So take a look for that information. And before we move on, I'd like to give you a little bit of information on some of the context of the work that both CCBR and ECN do. The Center for Community-Based Research is a nonprofit organization. It's located on the University of Waterloo campus, and it has been around since 1982. CCBR has completed more than 400 projects on a range of societal issues, including over 100 projects related to family support and early childhood development. Their mission is to build responsive and supportive communities. Sherry's put the link to CCBR in the chat if you'd like that. The Evaluation Capacity Network is a national interdisciplinary and intersectoral research network located on the University of Alberta campus. Their mission is to enhance the evaluation capacity of the early childhood field, and they draw on the skills and expertise of academics, students, evaluators, funders, and community organizations across Canada to create evaluation learning opportunities and provide access to resources and expertise. And Sherry will put that website in the chat for you as well. Both of these organizations offer customized support. For those wishing more information or guidance with community-based evaluation projects, you can reach out to either one of them or visit their websites for more information. So by the end of today's webinar, we hope that you will have learned a few things. First, learning a little bit about the basics of community-based evaluation, learning about the implementation steps of community-based evaluation, and learning and hearing some examples about how community-based evaluation can be applied to real-life programs and situations. And we're going to do that in 3 steps. So we'll walk through an overview of community-based evaluation. Then we'll go through and unpack the 4 phases of community-based evaluation, and we'll open it up to a discussion at the end and take your questions. And with that, I'm going to turn it over now to Sherry, who's going to walk you through an overview of community-based evaluation.
Thank you, Judith. And hi, everyone. Welcome to today's session. We are so glad that you decided to join us today. So I will start by giving a summary definition of community-based approach to evaluation. So what do we mean by this approach? So this approach involves active participation of stakeholders. And by stakeholders, we mean those whose lives are affected by the issue under study. And we want to involve stakeholders in all stages and phases of research and evaluation with the purpose of producing useful results and making positive changes. When we talk about community-based evaluation, we want to consider its 3 hallmarks. It's stakeholder-driven, participatory, and action-oriented. So what do we mean by stakeholder-driven? That means you as practitioners in your organization and program have control over your evaluation. You're sitting on that driving seat. Also, it means that your evaluation is driven by your program's unique theory of change. So in this webinar, we will briefly talk about the theory of change. This approach is also participatory. That means key stakeholders of the program are identified and meaningfully involved in all stages of the program evaluation, from planning to implementation and sharing your evaluation results. It's important to note that in this approach, program stakeholders and researchers are in equal control over the evaluation agenda. And lastly, this approach is action-oriented. So we just don't want to do an evaluation to write a final report, but we want to act on the findings and contribute to positive changes. So we have 3 hallmarks and followed by 3 goals. Evaluation is research. So we produce knowledge by asking questions, gaining new insight, but we also want to share those learnings and evaluation findings and communicate them in a way that others can use these findings and results in their positive decision making. So learning something from the evaluation and sharing those learnings is not enough. Community-based evaluation is also a relational exercise where we engage different stakeholders in different phases of the evaluation. And this results in building stronger relationships between different stakeholders and also equipping them to do and use evaluation together. So we have 3 hallmarks followed by 3 goals, and we have 4 phases with 11 nonlinear steps. We also call this an evaluation GPS or map. So it helps us to understand where we are in the process of our evaluation. The slide decks that Judith mentioned earlier go through all these steps and 4 phases. There is also plenty of exercises in the corresponding evaluation workbook for practice. So when we look at this GPS, we see a difference with the committee-based approach to evaluation and traditional approach. So in the traditional approach, it only focuses on evaluation, planning, and implementation. However, for the committee-based approach to evaluation, we have 2 extra phases: laying a good foundation and making sure that we act on the evaluation findings. So in today's webinar, we will briefly unpack each of these phases and steps and share real-life examples with you. Over to you, Rich.
Great, thanks, Sherry. So last webinar, we focused on the usefulness of community-based evaluation. How do we make evaluation useful for your organization or your stakeholders? And today we're focusing on doing the evaluation. So what are the implementation steps? And so for the next portion of this webinar, we'll unpack each of those 4 phases that Sherry has mentioned, the 11 non-linear steps. We'll go through all of them. And April and I will do this kind of together, where we'll just have a bit of a dialogue. I'll go through each of the steps, and then she'll illustrate it. She'll be the interesting part in bringing those steps right into into practice and into action. I should also mention that as we talk through all of this, those slides that Judith has mentioned at the beginning, those 5 slide decks, those are kind of, we're following the same format as those. And the workbook actually helps you as an organization to gather your stakeholders together and create this kind of a plan that we'll be unpacking right now. So let's start with phase 1. It's a good place to start. And in phase 1, we have 4 non-linear steps there. 4 things that we need to think about as we're laying the foundation for our evaluation, not rushing to our methods and thinking about how we gather information right away, but pausing a little bit. Because it's stakeholder driven, it's participatory and action oriented, we want to lay a good foundation to make sure that we're engaging people in a way in which they feel that they are driving the evaluation agenda. So a good place to start in step number 1 is just identifying your stakeholders and organizing a steering committee. And so we sometimes talk about stakeholder mapping, thinking about who has the lived experience within whatever program or intervention that you're working with. And then thinking about the influencers, whose work or life also influences those people who are at the center of the issue. Then there's the sustainers, those who have maybe resources or policy that direct some of the programs. So funders, government, are example of sustaining groups, maybe networks, comprehensive community initiatives. So thinking about those stakeholders, mapping them out, and then thinking how can we meaningfully involve them throughout the evaluation process. And one key mechanism of doing that is forming a steering committee. And at CCBR, we always have a steering committee guiding all of our evaluation and our other research work. And we make a distinction between the doers of the evaluation, which is the evaluation team, the people who are going to be collecting information and analyzing it and doing most of the actual legwork, the doers versus the guiders. And this is what the steering committee is. Before the doers do anything, they are guided by the steering committee, who, from their cross-stakeholder perspective, critique, react to, give advice on the plans that the evaluation team is thinking. So that's the first step, identifying your stakeholders, thinking how to involve them. One key mechanism is a steering committee. A second I'll just mention before we go to the next slide, could be involving some people who are living the issue under study as co-researchers, joining the evaluation team, being part of the researchers. And so whenever possible in our projects, we try to have people with lived experience as a part of the research team. It's not always possible, but that's something to aspire to. Step number 2 is identifying assumptions about evaluation. The word evaluation evokes a lot of different thoughts and emotions in people. For some people, it's like going to the dentist. You know you got to go there, but you just don't want to go. For other people, they just love it. So take some time with your steering committee and others to talk about what are what do you mean by evaluation? What are your experiences of evaluation? What are your expectations of evaluation? And what does a community-based approach to evaluation mean? Is it similar to what you've experienced before? Is it different in some ways? So talk that through, not just assume that everybody's on the same page in understanding what evaluation is. And then finally, talking also about roles and responsibilities. How do you want to work together? As a steering committee in our first meeting, we always have an agenda item is principles of working together. And then clarifying what's their role as a steering committee versus what's the evaluation team roles. And so clarifying those up front in the laying the foundation phase. Step 3, this is where it gets interesting. You want to highlight your context. And because community-based evaluation is a very contextualized way of doing evaluation, your specific unique context matters. It's what should really direct and dictate how the evaluation unfolds. And one way to do that in evaluation is making sure you're clear on your theory of change and doing this together as a group, clarifying what you do and to what end, what you do, the activities, and to what end, your intended outcomes. And often a theory of change is summarized in a program logic model. Not always, but it's a common way in evaluation to do one, and April is going to show one of hers in a moment. But really a program logic model in a graphic form shows the activities and outcomes, as you can see below. Outcomes can be divided into kind of a temporal way, like how they evolve over time from immediate to ultimate kind of a time frame. And then some logic models also add inputs, the resources that are fueling the activities, and the outputs, some of those tangible things that you can count that you did. Outputs are different than outcomes. Outputs are the things that you've done and the products you've produced, versus outcomes are the changes that have come as a result of your activities. So outcomes is often what you have to push a little harder to try to understand. Why are you doing the work that you do? And they're a little bit harder sometimes to actually go about and gather evidence for. So April, do you want to show us one of your logic models that you did in your work, and maybe give us a little bit of background of this project and your connection to it, and then unpack this cool looking logic model you got here?
Thanks. Yeah, hi everybody. I'm April. I'm here from ABC Head Start Society, and I'm super happy to talk to you about my experience as a partner in community-based evaluation as it applies to 2 different projects with ties to the Evaluation Capacity Network. One was a study of behaviors experienced in the early learning classroom and how equipped staff were to respond to them appropriately. This project was a collaboration between E4C, Oliver Center, and ABC Head Start, who together we make up the Edmonton Head Start project under CAPC. The second project I'm gonna sort of draw on today was, it's currently ongoing. It's an evaluation that is in process right now of the SCERTS model as an intervention for the issues that were revealed by that first project, the behavior research with the Edmonton Head Start project. And this logic model is the logic model for this SCERTS evaluation that I'm currently doing. It was developed by Sarah Scott and Karen Edwards from CUP at the University of Alberta, and they consulted with me a lot through the process to make sure the work met our agency goals. So yeah, you can see here, SCERTS is social communication, emotional regulation, and transactional support. It's a model of responding to behavior as communication. Well, it includes that. That's not all it is, but it's part of it. And we have our inputs here. Those are our resources that we were going to be able to put in as an organization, the activities that we would complete, the outputs, and then we've got our short-term, medium-term, and long-term outcomes. And then down at the bottom, the assumptions, actually, that part was one that we talked about a lot because we had to get on the same page about what were our assumptions going into this and what was our ultimate goal.
Great, thanks, April. We'll come back to these 2 case examples as we go through all 4 of these different phases. But just to finish off phase 1 with the 4th step of identifying the purpose of the evaluation, in some ways, this is the most important step in the phase, that together as a group, you come up with the unique purpose of your evaluation. There's many purposes for evaluation, and you come up with, what do you want to learn? Think about your evaluation as an opportunity to develop your organization and learning and learn together. And so we often encourage in our workshops to have people write out a purpose statement, which sounds easy, but it's a lot harder to do when you're actually trying to figure out exactly what you want to do. And so we encourage people just to simply start off with an easy phrase: the purpose of this evaluation is to. Just to get something on the page. And sometimes in the next word might be collaboratively, to remind us that this is participatory evaluation. And then comes a verb, which tells you what kind of evaluation it is, whether it's more summative, like judging, determining, assessing kind of evaluation, whether it's formative, where you're trying to understand or investigate something, or if it's more developmental evaluation, where you're trying to create or to develop your intervention as you're learning. And in the middle comes the big part of the purpose statement, which is defines the scope, the target audience, the focus of the evaluation. It gives you a heads up of whether this is a process evaluation that's looking at the activities of your logic model, or an outcome evaluation that's looking at the outcomes of your logic model, or both, as many evaluations nowadays do. And because it's action-oriented, that third hallmark that Sherry mentioned, there's often an in order to statement. That yes, we are learning about something, the first half of the statement, but we're doing that for a reason. We want to use that learning for some end and explain the use of the evaluation. And as a group, come up to that statement together and negotiate that, wordsmith it. And April, why don't you share us your SCERTS evaluation purpose statement?
Sure. So SCERTS is well evidenced. So we weren't trying to figure out if SCERTS worked because it's well evidenced that SCERTS works. It's an evidence-based program that has lots of research behind it. So we wanted to explore how the model may work as an intervention with our population to determine the impact on our organization, our staff, our families, and our children, and then to make suggestions for improving our implementation of the intervention. So we were looking at, is this the right intervention for the problem we've identified? And how can we best implement it to get the most out of it according to that problem?
Excellent, April. And just to keep that slide for a second longer, because this is kind of like a classic community-based evaluation purpose statement, a really good example. 3 components to it: process evaluation component to it, a outcome evaluation component to it, and because it's impatient about doing things better, it has that kind of future directions focus to it as well. We don't want to just learn, we want to also do something based on what we're learning. So that's the laying the foundation, the 4 phases. And April, you've given us some two different programs, and just to ask you to maybe illustrate some of these 4 steps in your through those 2 different programs, and just to maybe name up front that you had outside involvement, you had help in doing this evaluation through the CUP from the University of Alberta, but their role also changed a little bit between these 2 programs evaluation. So you might want to comment on that as well as you give illustration of these 4 steps.
Sure, I can. Yeah, okay, so the first thing in identifying stakeholders and organizing a steering committee, the way that happened, we initially engaged with CUP, and then they facilitated the process of roles and responsibilities. We had put together a steering committee of representatives from each of our organizations. So somebody from E4C, someone from Oliver Center, and someone from ABC. And we met regularly with the research team so that we could really, it was all about laying out those goals and what the process was going to look like on both sides. One of the, you talked earlier in this section about assumptions, about evaluation and addressing those right at the beginning. And I have a small story about that. In the beginning, our steering committee, we had some really elaborate ideas about how we would find the answers we were looking for, things like interviewing parents and observing or recording classroom interactions, and things that were really, I guess, high resource need and also high sort of risk according to ethics when you're doing research with children. And the research team sort of brought us down to earth by helping us understand that as long as we triangulated our approach, we could really start small and work within our capacity and use data that we already had. So that was, I think that fits in this section as well. Yeah, when you're talking about their role changing, so in the beginning, the research project CUP, I won't say they were the driver, because we were still the ones saying, you know, yes, no, we want to do this. We can implement that piece if you can prepare the materials for us. But they were very much our advisors and guiding us along the way. And they did some of the stuff completely independent. They did a review of our critical incidents, and we weren't involved in that. We wanted it to happen, and then we sent the info, and then we got the results. Whereas now, with the evaluation that we're doing of SCERTS as an intervention for this, I'm really in the driver's seat as the community partner and the person at my agency who is overseeing evaluation of programs. So CUP developed the plan with me in collaboration, but they did most of the work on the plan. I met with them maybe once a month, and in between we would consult on documents, and they created this beautiful evaluation plan for me. And it has everything, you know, the logic model, the theory of change, all of the methods, like all the surveys are written, everything is ready that I can just pull it from that document and go and implement it. But CUP's totally out of the picture now until that time that may come when I need help with analysis. So in between the planning and the analysis, we're able to completely implement. And a lot of that is based on capacity that was built within our organization during that initial research, because we learned things just by participating that we can now apply, like ethics conversations, and all of that stuff was helpful.
That's great, April. So what I'm hearing you say is, like, you had a steering committee guide both of those evaluations. But even in your research team, your evaluation team, that changed from one project to the other. In the first project, CUP was a big part of the research team doing some of the work. You were still, as an organization, in control over that evaluation, how it unfolded, but they did a lot of the work. And in the second project, you're now doing most of the work, and you kind of flipped roles, and they're just supporting you in doing some of the work. And so if you think about a community-based approach to evaluation, yeah, you can rely on outside consultants or groups to help you if you find a faculty member somewhere. But still make sure that you as an organization, as the practitioners, are having your hands on that steering wheel, right? That even if other people are helping and supporting you or doing more or less work, that you're still in control of the overarching agenda. So that's all part of laying the foundation. You might want to add some chats and questions for the open discussion around that phase. But for the moment, let's move to phase 2, because we got 4 phases and only so much time. And we'll talk about evaluation planning. And here it shifts from negotiating roles and goals to whose perspective should be included, whose voice should be included through the evaluation. And there's 3 steps that we want to cover. The first being determining the evaluation questions. And evaluation questions are like hand in glove with your purpose statement. If you read them together, they should make sense. Your purpose statement, and out of your purpose statement flows the main research questions. Now, the main research or evaluation questions aren't the questions you necessarily ask of evaluation participants, but they're the questions that at the end of the evaluation, you want the answers for. And so usually there's maybe 2, 3, 4 main evaluation questions that you want to identify. And on the slide, you can see some different types of evaluation questions. If you're thinking about activity part of your logic model, those are more process-oriented questions. How you are implementing your program, asking questions about the activities that you're doing. And the outcome questions could be about the change that you're hoping to see. To what extent have you reached those changes and other aspects of the outcome parts on your logic model. And you may also want to ask a question or 2 about future directions. How are we going to use the results? How are we going to make the program better? How are we going to improve our theory of change? Because we might learn that we're not exactly doing what we should be doing, and we can improve even the conceptualization of our program. And so here, April, you have an example, right, of your main research questions for the SERTS project.
Yeah, these are from our project. And we had process questions, outcome questions, and future directions. So those followed the purpose statement, the 3 parts of the purpose statement.
Great. So once you together have come up with the main evaluation questions, how do you go about answering them? And now finally we come to methods. And notice again, we didn't start with methods. We didn't start with a survey or an interview and say, let's do them, or is this a good survey or not? We laid the foundation first, and we became clear on the questions that we uniquely want to answer for our evaluation. And now we ask the question, how do we answer them? And as April mentioned, we always start with what we've got. So probably in your filing cabinets or servers on your laptops, you've got data, you're collecting it. It may be useful to answer some of those questions. Maybe not all your data you collect is helpful, but some of it may be. And so start to think about that. And then you think about adding new data, primary data, data that you collect yourselves, your evaluation team collects, as opposed to the secondary data that's already pre-existing. And when you're thinking about different methods, you can think about data in 2 different categories: qualitative data, which is word-based or maybe visually based, and quantitative data, which is number-based. And there are different methods just being how you go about gathering data. There are different methods that lend themselves more to qualitative and others more to quantitative. And you can see examples, not exhaustive list here, but examples of some common methods that are used in evaluations. And that gold circle off to the right is kind of a key point in making sure that you do your evaluation with rigor. And you can kind of distill it down that if you want to be very rigorous in your community-based evaluation, make sure that you use multiple methods, not just one, and include multiple perspectives, not just one. And so the trick is to think about as the methods from maybe some quantitative, some qualitative, or depending on your purpose, maybe it's all qualitative or all quantitative. So think about multiple methods, because each method has a limitation and each method has a strength. And if you bring multiple methods together, they kind of help each other out. And multiple perspectives to make sure that you have a well-rounded understanding in answering to your main evaluation questions. And then the last step in this planning phase is trying to think about what are you going to do with all that data? Imagining all the words and all the numbers that you're collecting and anticipating what they would potentially look like and coming up with a plan to summarize how you would go about dealing with those words and numbers. And this is kind of more like you're not dealing with those words and numbers. You're not doing the data analysis yet in this phase, but you're anticipating and coming up with a plan for that. And so trust your design and your questions. So don't second guess too hard. Think about who would be involved, like logistically, like it's your evaluation team, who's going to do what, right? Do you need outside help in data analysis? Sometimes this data analysis is a step where groups need to have a little bit of help in dealing with all the data that they have. Do you need some help, or who's going to be doing it on your team? Make sure that you build in time for flexibility. Not always does data gathering go the right way or the way that you anticipate. And make sure that you build in some time for reflection, because you need to think through data analysis. It's not just a mechanical process. And make sure you talk with your steering committee about all of these 3 steps: the research questions, your choosing your methods, and also your analysis plan, so that they can speak into that. So April, now to you. How does this actually look like in real life?
So determining our evaluation questions was done collaboratively And speaking about the SURTS eval that we're currently implementing, Sarah would develop a draft, and then we would have a call together with Karen, and we would talk through each section and make changes in real time until it felt good for all of us. And if there was something we couldn't settle on, Sarah would take it away and she would try a couple things, and then, you know, we'd communicate back and forth. So it was very collaborative, and I really liked those meetings. I loved being involved just because I was learning so much. It was exciting for me because every time we met, I walked away more capable of doing this in the future. Developing the methods, Sarah offered me many options for data collection methods, and I got to speak to which ones we had internal capacity for and which ones I thought would be hard for us. And they really tailored that to what was going to be possible. That was the most important question. And I really appreciated that. If something was the best option in terms of rigorous evaluation, and I was like, I just don't know how we're going to make that work, they were like, no, that's good. We can find another way to find that information. So there was one method that we put as tentative because it was, it would be helpful as an addition, but we knew that I maybe wasn't going to have anyone to complete this set of interviews at this time of year. So she still built the interview guide for me in case I could find like an intern or something to conduct the interviews, but also made sure to build out the other methods enough that if we didn't have the capacity to do that, it was going to be okay. And we would still find the information that we needed in the other methods. So that was really helpful, that flexibility and tailoring things to what we could do. What else? So then developing the analysis plan. Our plan right now is for me to do what analysis I can. And then once the data is all collected, I can call on CUP for support as needed.
Great. Thanks, April. It sounds like a nicely triangulated design that you have with multiple methods, multiple perspectives, and also clear roles that you identified to be able to handle all of that, right? Research and evaluation is systematic, right? It has method. There needs to be done in a certain way to be able to collect quality data. And so a lot of those hallmarks of good research I noticed in your evaluation planning. Let's move to phase 3. I see questions starting to be posted. This is good on the chat. Phase 3 is where you implement the plan that you've created in phase 2. So this is the actual doing of your data gathering and then also analyzing that data that you've gathered. And so starting with gathering data, on the next slide, we have, the obvious is gather the data according to the plan and then adapt if needed. If you go just for a second, Sherry, to that previous slide, you'll see that loop back from phase 3 to phase 2. Sometimes in a community-based approach, because it is so contextualized, something may happen in your program or in your particular community that changes your plan. The best example from last year was COVID, right? You could have created an evaluation plan in February of 2020, and then started implementing that plan, and you needed to do some adaptations. Maybe you had to shift your focus groups from in-person to online or whatever. There were a lot of adaptations that happened in evaluations across the country in the last year. So that's that feedback loop going back to planning. You're not changing the purpose of your evaluation. That's in phase 1, but maybe you have to tweak even some of your questions. So we had many organizations who wanted to change some questions about how they're adapting. They added a question about COVID impact as a part of their new evaluation. So that's that adaptation part of gathering your information. The ethically part is something that you also think in throughout all 4 phases. But when you're actually collecting the data, you have to make sure that all the more that you're thinking about doing no harm, right? And making sure that that's always top of mind as you're going through the 4 phases of evaluation. And you're thinking not only in terms of individual harm, you're also thinking in terms of organization or community or collective harm. And we think about ensuring ethics or challenge ourselves around ethical issues in 3 different ways, 3 concrete mechanisms that you could use. You could hire and train or involve community researchers, people who are living the issue under study, as part of your evaluation team. They have the lived experience. They'd be more attuned to some of the blind spots that other evaluators might not be aware of. You have your steering committee. Think of them as an ongoing ethics committee. That a part of their role is also to either anticipate some ethical challenges and raise them, or react to some of the challenges that might arise and give some advice to your evaluation team around that. And a third way is you could seek outside help for your ethics review. And we have those 4 and 5 are actually 2 examples of outside ethics review. At CCBR here in Waterloo, we've created CREO, the Community Research Ethics Office that anybody in Canada can use, that does ethical review according to academic standards, the Tri-Council standards, the 3 principles that academic funders or academic researchers use, but adds a 4th principle of community harm. And so it reviews evaluations and other community-based research through the lens of community-based research. And in Alberta, I understand that you're also ethics Iraqi, I don't know how you pronounce it, but you have that too, right? And you have the websites there that if group wants to go. Over to you, April. Oh, no, step number 9. We got the data, now what to do with it. And so this is, this is courses in itself, but just briefly in one slide, how do you handle the data? Well, you may have quantitative data, numbers, and you may have qualitative data, which are words or images. On the words or images side, you do some sort of reducing, right? You're summarizing from all the words into fewer words. Content analysis is one technique to do that. And typically you start by methods. So if you've had focus groups or individual interviews, summarize those, analyze those methods by method. What does each method say about the main research questions? And on the quantitative side, you need to do stats. And stats is just looking at patterns. What do the numbers say? What are the patterns in the numbers? And it could be as simple as descriptive statistics that just tell you how many people did this, that, or the other thing, whether the averages, those kinds of things, what are the percents, or it could be more complicated. And again, you can think about both method by method as well as by stakeholder. But then when you get to the summary part, you got to bring that all together. Remember, you're trying to answer your main evaluation questions, and you answer them across methods and across stakeholder perspectives. So what are the top answers across the methods and across stakeholder for each of the questions that you have? And really your evaluation report, the findings section of your evaluation report, can follow those main research or main evaluation questions that you set off at the beginning of your evaluation. Now, April, this is your moment to make it sound real.
For sure. Okay, so gathering information ethically, we were able to put quite a few of our staff through a RECCI, I don't know if that's right, I say a RECCI, it could be a RECCI projects, ethics training in 2018 and 2019. And that set us up strong for participation in these projects because we had, baseline knowledge of how to measure risk versus benefit, and just the delicate idea of that trade-off was, I guess, familiar to us. So that was helpful. Previously to us getting online today, you, Rich, had asked me if we encountered any tricky ethical issues. And I think, honestly, that most of that was handled by the research team at CUP. And I'll just explain that acronym because we had a question come in about what is CUP. It's Community University Partnerships. And in my scenario here in Edmonton, I think mostly they focus on the advancement of children and families. So it's a team of researchers at the U of A that have supported us with the 2 projects I'm talking about today. They had to go through, of course, their institution's ethical review process. So the plan was pretty well developed in terms of ethics, and we didn't have to play a huge role in that. There were some things we had to talk about, like how we would be using the findings of the initial research project, because we were doing research concerning children. And there were questions about whether this would be for quality improvement or if we were planning to publish something. So we had those discussions early on so that everyone was on the same page ethically. In terms of changes to the plan along the way, we did have to make changes to the timeline. We were 4 agencies working together. And of course, we all were at the mercy of our own instabilities, things that can change in the political landscape and funding changes that impact organizations like ours and our workloads and our day-to-day. So the project took much longer than we originally planned, but we did keep reevaluating the timeline until we got the work done. So that would be the primary thing that we had to adjust as we went along.
Great, thanks, April. So let's move to phase 4, which, as Sherry said, the first 3 phases really are about the doing of the evaluation, and phase 4 is about the using the evaluation results, acting on the findings. And I see a chat question: is community-based evaluation the only type of evaluation that is action-oriented? No, other evaluations, I hope, are also action-oriented, but for sure in community-based evaluation, we name it as important, and we include it as a 4th phase. We're not done the evaluation in our minds, if we use this approach, until we are doing the acting on the findings. And so we want to just turn to that for the last few minutes. And here there's 2 steps: sharing learnings and initiating new action. In terms of sharing learnings, this is where people with communication skills are really good to have on your evaluation team. How do you package in digestible formats your results to the specific audience that you may have, or audiences that you may have? You may have audiences as being participants of your program. It may be funders. It may be policymakers. So you may have multiple audiences. You may have multiple communications. You can think about different formats as you have on the screen here: written, visual, or oral. There's a lot of creativity that's coming out nowadays with communicating findings. And you can link your sharing of learnings to the next step, which is actually thinking about initiating new action on the next slide. So you could organize activities in which you share your learnings, and at the same time, when you're sharing those learnings, you say, now what then shall we do based on these learnings? And facilitate people to come up with new action. So whether that's with your board of directors, with your staff team, with your community partners, you can think about involving others in not only the sharing of the learnings, but also involving them in thinking about what the recommendations or the actions are. Your steering committee is key to this. By now, I hope you see that if you facilitated your steering committee throughout this process, they're not just waiting for the results, they've been actively involved throughout. And the key for initiating new action is for the steering committee to own those recommendations. They feel that they are their recommendations, that they've helped to develop because they were part of the process. And therefore, it's more likely that there will be implementation of those recommendations if they were meaningfully involved. And at the bottom, you see build a culture of evaluation. And that's the notion of these 4 phases are like a cycle. That after phase 4, you can think about starting in phase 1 again and thinking about, now what's your next cycle of evaluation going to look like? Maybe a little bit different, maybe similar, maybe some different stakeholders involved because your focus is a bit different, but always thinking reflection and acting in order to prepare yourself to be able to reflect and act again. April, over to you.
Okay, phase 4. So sharing our learnings for our initial research project, we received from CUP, and as a result of our collaborative work, a literature review, an infographic, and a written report of findings. The infographic was definitely the most widely used and understood within our organization, and I think it was the most engaging because it was the part that involved the findings that came directly from our staff. So yeah, it was really built with the audience in mind. The data reflected There was a specific report of staff responses to a staff perspective survey that was conducted, and CUP demonstrated the importance of reporting back to the staff as participants and sharing with them how their responses had been summarized and how that information would be used. So we were able to distribute this at all 3 Head Start agencies that participated in the research. And I got the impression that the staff really appreciated being involved in that closed circle. And then when it comes to initiating new action, I think it's interesting to note that our current evaluation project for the SCERTS model is actually an action initiated by the findings of the first project, which was the research on behaviors in the classroom. So we found that we required our staff to have different skills and more specialized training that would help them respond to behavior as communication because of a change in the demographic that we were serving. So we sought out pre-existing evidence-based models that address this. CUP helped us build the evaluation plan to measure how well the intervention will work for addressing that need, and that's where we are now. Rich also mentioned in this section, you also mentioned building a culture of evaluation. And I like to think that we're pretty good at this at ABC because almost all of our employees participate in some kind of evaluative activity, whether it's developmental assessments that they complete with children or measuring progress on their IPPs, their individual program plans, completing performance evaluations with staff. All of these things are evaluative, and that requires evaluative thinking. So being able to partner with CUP on these projects has built my capacity immensely to support those activities in ethical and productive ways. And then one of the evaluation tools, I wanted to mention this too, that we are using this month as part of our SCERTS evaluation is actually so helpful for evaluating the quality of our service delivery that we're likely going to be incorporating it into the future as a quarterly review moving forward. So in that way, this project has improved our quality improvement process long-term. And we get to be in control as an organization of how these cycles go. Sarah, Karen, Jason, Shaban, and all the folks at CUP have really put us in the driver's seat, and they've supported us to direct that process, to leverage their expertise, and now to be able to direct those processes into the future.
That's great, April. I'm seeing questions being asked, so maybe we can move to that discussion part. And I'm seeing one of the questions was around ethical challenges, and I know you mentioned a little bit about that. Do you have an example offhand about how evaluation can, how ethics plays itself out in evaluation?
Is that for me, Rich?
If you can, yeah.
Yeah. Well, when we were talking about recording, first we were talking about going in and observing behaviors in the classroom. And then we realized that having a new person in the room can actually shift the environment and the behavior in the room. So we're like, hey, that's not going to work. And then we're like, what if we set up a camera? And then the researchers were like, well, let's not go there first because that's a high risk. That's a high risk activity for benefit that we might be able to get by just doing things on paper with info that you already have. And if I can, I guess the question is example of potential harm that could result, right?
Yeah.
Well, we were also talking about interviewing parents. And I guess in that regard, what we were worried about was if you're sitting down a parent to talk to them about, your child is one of the children that exhibits challenging behaviors in our program, we try to be strengths-based. So there's a huge potential for harm there if we're involving them in research with the perception that their child is a bad child, because that's not how we want to look at behavior. We want to look at it as a function of them trying to get their needs met and trying to communicate what they need. So we don't want to give the parent the wrong perception and label their child. And it could also cause some emotional harm for the family. And then recording the children, I think a lot of that is based on how that information is going to be stored and used afterwards. But I think the researchers on the call right now would probably have better understanding of how to explain that than I do.
Yeah, there's potential for harm in a lot of places. And the thing about harm is that we're all sometimes blinded to unintentional harm, right? And so a key principle in in ethics is about informed consent, for example. A simple thing like people may feel like they have to answer in a certain way or else they will not receive the services, right? That unless you clearly mention that, hey, you're free to answer the way this is confidential, what you're saying may be anonymous, that your opinions won't be linked to your identity in any way, so be free here, and you won't, your children will still be able to attend no matter what you say. Those kinds of things where we sometimes just assume that people understand that. That's an example, another example of harm. Trauma, vulnerability, not re-traumatizing people who may have had trauma by asking some questions that may trigger emotion. Those are other examples of harm. Maybe more technically, somebody's asking about, you mentioned that, April, that you've triangulated your data and wondered what existing data did you start with? If that's a good place to start, what drawers did you pull open to explore your data?
Yeah, well, I think the thing that was most illuminating was taking a look at our critical incident reports. Whenever something happens in the classroom that puts anyone at risk of, harm, then the staff fill out a critical incident report and it goes through a process. So those are all stored, and we were able to dig up the critical incident forms from all three agencies, E4C, Oliver Center, and ABC, for the previous 12 months. And then the research assistant, Siobhan, went through and she codified all the behaviors. So she put them in categories, and this is how many times defiance was reported, and this is how many times flight risk, like a child might run away. And then when we looked at that at the end, it was like, it just so much became clear to us. We saw that maybe something like 70%, I hope I'm quoting this right, but just be aware these numbers might be off because I'm off the top of my head right now, of those critical incidents had come from the same like 13 children. So we saw that actually it's a certain situation or case that our staff aren't equipped to respond to. So there's these children that are getting dysregulated at the sort of top of the regulation pyramid. And we obviously need to build skills within our team to work in that specific scenario. Because if we can take care of that, then everything else takes care of itself. So that was huge. That one piece of data that we already had on site was massively helpful. And then we did a survey of staff perspectives to find out if they thought that the classrooms had gotten more difficult to manage over the last 5 years, and why they thought that was, and what they thought they needed in order to meet the needs of the children in a different way. And then there was the literature review was the third piece, to see what in the literature can we find that could give us some clues to why the staff are noticing that things are getting more difficult to manage.
Great. I think we have 2 more questions, and we probably have just enough time to quickly touch on them. One question about the phase 4, linking the 2 steps in phase 4, sharing information and facilitating for action. How does that look like? Who's involved in that? I don't know if April, if you have something off the top of your head, or if you want me to respond, how would you? Do you have an example maybe from your first, because you're still halfway through your second evaluation, right? That you're not at phase 4 yet, but in your first evaluation, when you were facilitating people for action, you're sharing the results and encouraging action to happen?
Yeah, sorry, I'm just reading the question to try to understand it a little bit better.
Yeah.
Who would be involved in that facilitation role? Okay. Yeah. Oh, so that was us. In this case, I think it could be different in different scenarios, but in our case, it was us who facilitated the action. We got the results of the research, and then we started talking about what are we going to do about this, because the purpose of doing the research was so that we could solve an existing problem that we had. And we had a supervisor here, Jen Wallace, who was really passionate about just getting better at meeting children's behavioral communication. And she was the one who went digging for programs that we could try. And she found SCERTS, and we facilitated the whole process. We found someone in Edmonton who could train our staff. We've done training over the past year. And then we actually also, through Edmonton Head Start project, E4C and Oliver Center supported us under our CAP-C umbrella to go out and engage CUP to help us with the evaluation of that. So yeah, does that answer the question? I think that's the question, that it was us.
Yeah, I think so. Yeah, and you know, if I would add to that often we would involve the steering committee to say, so how are we going to facilitate this action? And often the steering committee members are part of that presentation of sharing the findings. So that's not only the evaluation team that's seeming to own the results, right, and the interpretation of the results. It's the steering committee that shares that ownership and also helps to facilitate that action. That can look differently depending on the type of evaluation and you know, how it plays out in a particular organization. One more question. Is it recommended for nonprofits to use university people, academics, in helping them with their community-based evaluation? Obviously, April, in your example, you did that, right? You reached out, you are in Edmonton, you happen to have a part of the University of Alberta in town who understands community-based approach to evaluation. So the way I would answer that question is, it depends. It depends if you have cup-like people. Not all, and it depends what you want their role to be. Remember, your hands are on the driving wheel of the evaluation, not to give that up. Some academics are very familiar with community engaged scholarship. They understand that role. That's a different approach, a different posturing, and some may struggle with that. So make sure that you don't give up that control of the evaluation agenda, and negotiate with them the roles that you wish that are useful for you. We have a lot of people that ask us this question, a lot of nonprofits, and so on our CCBR website, on our homepage, we actually have a little bookmark, which is a checklist that if an academic comes to you and asks you to work on their research, or if you want to have academics help you with your evaluation, here's some things, here's some tough questions to ask to make sure that it's a community-based approach that can help you. It's a short little checklist that we have that covers many of the things that we talked about today, but just summarize it in a really, really brief way. So you can look that on our communitybased-research.ca website to help you decide which academic to work with if you need that external help. There are other consultants, same thing for other consultants who are non-academic consultants. If you work with them, here, those are good questions to ask those types of supports as well.
Great. I think we got all the questions, and we're pretty much right on time. So thank you, Rich and April. Fantastic information, and the real world examples really brought the 4 phases to life. So that was very helpful. Thank you for that. And also we will be sending out, and thank you everyone for joining us today. We will get a survey by email, right, Sherry? So please take some time to help us learn how to do what we did well and what we can do better. That would be fantastic. And again, thank you for joining. This recording, as well as the previous recording, will be posted on the CCBR website and the ECN website, which Sherry has put in the chat there for you. So thank you everyone for joining us today, and thank you again, Rich and April.
Thanks, everyone.
Thank you. Thanks for having me.